Welcome to Adapt NCLEX, video number 9, Maternity Nursing NCLEX Review Practice Question. For this particular one, I'm focusing on postpartum care, 10 high-yield critical thinking question, must know for the NCLEX and nursing school. Let's get together and solve this postpartum care information that you need to know for your NCLEX. First question. Each of these questions contain a concept, and one concept is what I'm going to test you. This requires some critical thinking and prioritization, patient prioritization. Which statement should the nurse be most concerned about? A nurse is returning phone call to several clients 6 days postpartum. Which client statement should be concerning to you? My hands feel numb after holding the baby for a while. My peripad contained dark red blood. These two had bright red blood in it. I have been more emotional and cry easily. Which of these patients should you worry about? Stop the video, answer the question, put down your answer, and let me know what you think. But based on the content, after delivery, there's a fluid shift. It's common to have something we call carpal tunnel syndrome. So your hands should feel numb after holding the baby for a while. It's expected. A peripad containing dark red blood is unexpected because it's 6 days. After 4 days, you should not have Lochia rubra. Therefore, this lady, she's bleeding. 6 days is a problem. My stool had bright red blood in it. This is called what? Hemorrhage. She probably had hemorrhage. I'll be more emotional and easily what? Crying. What is the problem? This is postpartum blue. And you can see based on that, number 2 is the right answer. A dark red is rubra. Should be gone by what? Day 4. And therefore, number 2 is our right answer. We're going to use this content, this strategy to answer each question. A nurse is teaching a postpartum client about what? Breastfeeding. What am I going to teach you here? Breastfeeding. If you have not seen a video about it, write it down. Concept. If you're in nursing school, no breastfeeding. And for the NCLEX, no breastfeeding. What are the things they're going to ask you? Which statement by the client indicate a correct understanding of the teaching? Most of the question, it will be about what? Teaching, teaching, teaching. And therefore, watch what I'm going to do. Select or apply. We want to indicate, pick a correct understanding. I should bring my baby to my breast when they show early anger cues. Is that what you do when you want to breastfeed your baby? For the NCLEX and nursing school, I should feed my baby on a strict 3-hour schedule. Is that what you want to do? Every 3 hours, feed the baby. I will allow my baby to finish feeding on one breast before switching to the other breast. I will wash my nipples with what? Soap before and after every feeding. I should expect my baby to have at least 6 to 8 wet diapers. There's a content here, and I'm going to give it to you, and I want you to write them down. Every time they ask you questions about breast and breast teaching, feeding, this is the way they're going to ask you. You feed on demand. That's the cue. Feed on demand, right? You don't feed every 3 hours. Therefore, 1 and 2 are contradicting each other. Therefore, 2 is wrong. I will allow my baby to finish feeding on one breast before switching to another. Yes, because you want your baby to get the fore milk and the hind milk. That's where you get most of the antibody. The end of it is the most important. I will wash my nipples with soap before and after every feeding. No, soap on the nipple is going to make it dry and you get sickness from it. You get infection from it. What you need to do, warm water. I should expect my baby to have at least 6 to 8 wet diapers daily. That is good. It means hydration after breast milk. And therefore, what are our answer? Number 1, feed on a cue, not on demand. Switch from one breast to another after they finish it completely. We have another question. I will show you how many times you're supposed to feed on each breast. And you want to stick around to watch that one. As we go with the video, the question get harder and harder and more concept. And you want to get to them. And there will be a second part associated with this video. And therefore, those are the right answer. No soap. And nurse is assessing several postpartum clients 12 hours after vaginal delivery. They just deliver 12 hours. Which client need immediate intervention? This also is based on concept about what you look for when they are postpartum. It's talking about bleeding, postpartum hemorrhage, which is associated with their part, what we call Lochia. If you saturating a peripad every 30 minutes, should you be worried about 12 hours? Saturating a peripad every hour, should you be worried about? Saturating more than one peripad in an hour? Saturating 2 peripad in 2 to 3 hours? Saturating 1 peripad in 2 to 3 hours? Passing cloth larger than a golf ball. I designed this question to test your mind. I want to give you every angle so that whenever they ask you a question regarding a peripad, you are in strong position to answer it. What do you think is the concept? Try this one and let me know what you did. Stop the video, put the answer in the comment section and let me know. But there's a content associated with what? Answering this question. And it's 3 words. And this is it. If you saturating a peripad less than an hour or an hour, you are in trouble. Therefore, 30 minutes is less than an hour, 20 minutes less than an hour, 50 minutes less than an hour, or equal to an hour. That's the first one. If you saturating more than one part within an hour, it's also a problem. You got to write this down. And if you pass in large cloth greater than a golf ball, it's still a problem. These are the 3 conditions you need to know about somebody with the peripad when you see a question. Therefore, if you saturate more than 1 peripad in 1 hour, that means 2 peripad in an hour, you are in trouble. Even I give you a scenario, if you saturate 1 peripad in an hour is a problem, therefore 2 peripad, that means more than 1 is a problem too. If you're saturating less than 1 hour, that means every 30 minutes you are in trouble too. And if you're saturating peripad every hour, that is the original condition, that is a problem. And of course, if the clots are larger, more than the golf ball, that is bleeding. Saturating 2 peripad in 2 to 3 hours, if you calculate it, 2 to 3 hours, that means the average, okay, when you saturate 2 peripad is about 1 hour and 30 minutes. That's okay. And if you saturating peripad, 1 peripad in 2 to 3 hours, that means it's also more than an hour. So that is good. So 4 and 5 are not the problem. They are moderate, but they are not severe. They don't indicate excessive hemorrhage at 12 hours. So that is the content. A nurse is caring for several postpartum clients, breastfeeding their baby. This is part 2 of what we saw. Which client need further teaching? We already know about breastfeeding. Now I'm going into deeper, giving you more content regarding breastfeeding. And those 2 questions should be your friend. There's a third one you want to stick around. The client is breastfeeding the baby 8 to 12 times per day. Is this what you should do? 8 to 12 times per day, feeding the baby? Clients breastfeed the baby when the baby starts suckling. Is this what you should do? You should give the breast milk as soon as they start suckling. Client position the baby tummy to tummy. Is that the position okay? Client breastfeed for at least how long? 18 to 20 minutes per breast. Each breast is being fed or used 18 to 20 minutes for the baby. And feeding for 8 to 12 times per day, multiple times, which is equivalent to 2 to 3 hours. Client offer same breast each time. So who need further teaching? Who need further teaching? Yes, you're supposed to breastfeed 8 to 12 times per day. If you calculate 24 divided by 12, that means at least every 2 hours. So 2 to 3 hours, you should be feeding the baby. And you should give them on demand. So when they start suckling, you should give it to them. It has to be tummy to tummy. And each breath, at least if you don't give it to 18 to 20 minutes per breast, you should offer different breasts all the time. These allow the breast not to engorge. These allow them to get all the feeding they need as much as possible. And this prevent infection. So the only answer choice is number 5. And this is caring for a client 5 days postpartum. which statement indicate the client is in what? Taking hold phase. There is 3 phases associated with postpartum. You have to know, I talked about it in the previous video. The first one is letting in, which is what? Let me write it down. The first one is letting in. And the second one is what? Letting out, which is what? Holding, that is taking hold. And the third one is letting go. Each of them has a concept associated with it, and I'm going to give it to you. It's good to know them because that's the way the question is based on, if you know them. So what does that mean to taking hold, which is the same thing as letting out? I need to rest. I can't focus on the baby right now. I want to try changing the diaper myself. I feel sad that I cannot care for the baby perfectly. My partner will take care of the baby until I recover. What does that mean, taking hold? It means what? Letting out. And the key is you are caring for the baby. You start to care for the baby. And this is the content. The first stage is letting in. That means you start talking about yourself. Then letting out, which is what? Taking hold is about the baby. You want to learn about the baby, things about the baby. And letting go is you are adjusting to the situation now that you have a baby. So which statement indicate letting out? That means you want to care for the baby. I need to rest. I can't focus on the baby right now. That is letting in about yourself. I want to try changing the diaper myself. I want to learn about the baby. That's the baby. I feel sad that I can't care for the baby perfectly. This is about you. My partner can take care of baby until I recover. Still, basically talking about you. You want to take your rest. Therefore, number 2 is your right answer. And then it's assessing a client who is 2 days postpartum. 2 days. Which finding require intervention? What do you think after 2 days? One said the fundus is firm, 3 centimeters below the umbilicus. 2 said fundus is firm, 2 centimeters below the umbilicus. 3 said fundus is boggy and deviated to the right. 4 said fundus midline and firm. What do you think? I know you got it because you watch Adapting class, and this question is straightforward. Don't think I'm tricking you. This is it. This is it. You know the content. As postpartum, the fundus is supposed to go down. So far as it's below the umbilicus, I'm good. It should be firm. So far as it's firm, I'm good. That's all. Therefore, 1 said firm is below the umbilicus, even though 3 centimeters usually is supposed to be 2 centimeters, but it has gone down more. It's a good thing. 2 is the most appropriate. 2 centimeters each day has gone down, but 1 and 2 are saying the same thing. The uterus is going down and is firm. If you go down faster, it's good. Fundus is boggy and deviated. It's not firm, and it's dilated and it's deviated. Bad problem. Number 3 is your right answer. And then she's teaching a breastfeeding client about mastitis prevention. This is the last question on breast, and you should be comfortable answering any question regarding breastfeeding and teaching. Which statement indicate understanding? I want to prevent mastitis infection. I should stop breastfeeding on the affected side. Is that possible? I will wash my nipples with soap after every feeding. We talk about it. I should alternate breast with each feeding, right? I will apply tight bra to decrease engorgement. If I want to breastfeed to prevent infection, there should be no engorgement, right? If you use tight bra, you cause more engorgement. For its bad statement. Alternating the breast is the best way so that each breast gets emptied every time to prevent engorgement. I will wash my nipples with soap after every feeding. It causes cracks and nipple dryness. I should stop breastfeeding on the affected side. You should feed even when that area is affected. Therefore, 3 is the best answer. And let's evaluate a client 1 week postpartum who report what? Tearfulness, fatigue, feeling overwhelmed, but denying suicide. There's a reason why there's a word deny, suicide, and it's 1 week early postpartum. Feel tired, tearfulness, right? Feeling overwhelmed. That means irritable, like emotionally, right? Very sensitive. What do you want to do? Refer them to psych, reassure this is postpartum and it's common, and monitor them. They should stop breastfeeding right away. Give them antidepressant. Look at it. It's either blue or depression or psychosis. Psychosis, they have hallucination. There's no psychosis. There's no depression because what? Patient is not suicidal. They are not hopeless. They're just tearful, emotionally labor. This is what we call postpartum blue. Reassure them. 9, and then care for a client after what? C-section. I know you got it. Adapting NCLEX got you. And you see the concept. I'm using each concept to answer the question. I want you to write them down. You stop the video and then write all the concept and watch the video, answer the question. You see where I go for the content and how I approach each question. Test-taking strategy, NCLEX practice question, right? Maternity, nursing, NCLEX review. We're using aspect analysis, explaining in detail the rationale associated with each answer and the wrong answer. And you do that and you get the content right there. How can you prevent thrombophlebitis? Like a DVT. It's not a true DVT, but early form of it. And there's care for a client after C-section. Which intervention help prevent thrombophlebitis? Let them walk, restrict fluid for 24 hours, apply compression stocking, and massage the leg. Let me know which answer choice you pick for this, because this is very good test-taking strategy, critical thinking. Think about the answer choice critically. Walking, compression stocking, restricting fluid, and massaging the leg. Massaging the leg does not help. Restricting fluid will worsen it. Now you're left with what? Encourage ambulation and compression. I would rather walk like than you putting something on my leg and squeezing all the time. Walking is the best way to prevent DVT, thrombophlebitis, than medication. Therefore, the best thing to do is what? Let the patient walk rather than compression. And the answer choice is encouraging ambulation, promote venous return, prevent blood stasis, reduces the risk of what? Thrombophlebitis. And this is the concept associated with that question. And that is the best answer. Walking. Last one. I know you get 9 out of 9. Now I want you to get 10 out of 10. And this is a concept this is a concept you should know regarding postpartum hemorrhage. I'm giving you the content. Write them down. Which of these patients has a highest risk of postpartum hemorrhage? Who? Prolonged labor, macrosomic infant, uterine atony, infant that is greater than 4,000 grams or 18 pounds and 12 ounces, or if you have a twin baby or chronic amnioitis. There's the content associated with postpartum hemorrhage. This is what we call risk factors for postpartum hemorrhage. Content is what? All of them are right. Anything that will make the uterus bigger, anything that will slow down the uterus is a problem. Prolonged labor, the uterus get tired. It doesn't contract easily. You bleeding. Macrosomic baby is big. And what is that? It's the same as what? 4,000 grams, 18 pounds, to 13 ounces. I'm trying to let you know what does that mean to have microsomic. If they don't give you anything greater than 4,000 grams, is microsomic. Anything 18 pounds and 13 ounces is microsomic. If you have twin baby, multiple gestation, you're going to have postpartum hemorrhage. Chronic amnioitis. Infection will cause the uterus not to contract, and that can cause bleeding. Therefore, all of them are right answers. All of them, these are right answers. So write them down. Risk factors for postpartum hemorrhage. 10 questions. Critical thinking. High-yield question. NCLEX practice questions with answers. In this rational maternity nursing. We're talking about postpartum care. Thank you for watching and good luck.